I'm Dr. Batista. I'm currently a resident at Mount Sinai. I also work at Settlement Health. So starting off with RSV. So we always talk in acronyms, but RSV stands for respiratory syncytial virus. It is a respiratory virus that causes infection of the respiratory tract. Common symptoms are those of fever, cough, nasal congestion, sometimes runny nose, and evaluation. So as far as like figuring out if anyone has this virus, what we do is a typical medical exam. And if we want to know specifically what virus someone may have, we use a nasal swab. Treatment, like the case for many viruses, would be hydration, medication for any pain, like muscle aches, fever, and it's really more supportive care. And that would be just things that help you feel better as far as like hydrating, sometimes steam vapors and vapor rub, things that just help us clear out our nasal passages and just like be able to breathe better. Just a little overview of like RSVs, the common virus. But what I really want to draw attention to here too is that it's very dangerous for babies and older people. These are two populations with a lot of different conditions. We definitely try to monitor a little bit more closely. And again, this just goes over the different symptoms that indicate infection as far as fever, coughing, runny nose. So here we have individuals at high risk of contracting RSV. That would be infants, older adults, anyone who's immunocompromised, just like their immune system is just like a little bit weaker. And that could be for a variety of different things. Could it be different conditions, medications that can put you at risk? Cigarette smokers, you think about anything that's going to affect the respiratory tract. If you are a cigarette smoker and you have constant like irritation of your lung passage of your respiratory tract, that will put you at a higher risk. And anyone with underlying lung or heart disease will be at higher risk of getting this virus as well as any other virus really that'll affect the respiratory tract. What's important to know is that the symptoms for RSV will differ. You'll see differences depending on like where you are as far as like the age spectrum, as far as like infants, children, adults. Because you think about infants aren't really able to like express when they're in pain, when they're feeling warm. So that'll manifest in the way of irritability. They're not feeding as well, might be more sleepy. Whereas adults will have like the cold symptoms, right? As far as like the runny nose, sore throat, cough. We can also be feeling more fatigued, more tired. With children, we'll see like more so the runny nose, decreased appetite, cough. Prevention. So this is one big thing that we all kind of focus on because unfortunately these viruses are out there and they do change because they're viruses. They do change every year, which is why for certain things we have like vaccine every year. So prevention is really key. And one way that we can do that is hand hygiene, just making sure to wash our hands, use an alcohol-based sanitizer. If you're not able to get to a sink and use water, masking, like the typical medical grade mask, N95, which would be kind of like the more protective one that you see. Mostly it's just really providers in the hospital to use. But masking, even for any of us, is important because if you think about anyone that has any sort of runny nose, cough, congestion, the way that these viruses are spreading is by those droplets. We call them respiratory droplets. So if you think about when you sneeze, when you cough, there's like these little droplets that are going on into the air. And when it gets colder, when we're indoors and we're like in smaller spaces, New York City, hard to have personal space, right? One way that we can really like limit what spreads is masking or by like covering your mouth and things like that. Vaccines. If you're a smoker, you're at higher risk of developing like these viruses and like the consequences that can come from developing any sort of respiratory issue. And trying to live a healthy lifestyle as best as possible. And if you have any sort of underlying medical conditions, making sure you're taking your medications regularly. If you need inhalers, taking those regularly to kind of limit if you were to get sick, how sick you could possibly get. Because every virus will affect everyone differently depending on what that patient's condition. So just a little bit more here on the RSV vaccine. So there's been 3 that are FDA approved. And the individuals that we could recommend to be vaccinated against RSV would be those between 60 74 years old that are higher risk. So those include those who are immunocompromised, those who have underlying lung and heart conditions, basically those who, if they were to get any sort of infection, have a higher risk of getting infection and then like any sort of consequences from that. Because one of the things we think about is with viruses. So one of these things that we can see is you can have a virus and anytime you have one infection, you're at higher risk of developing another. And one of those being pneumonia. Any adults over 75 years old, we're recommending to get the vaccine, and pregnant women and children. And unlike the flu vaccine that's given every year, the RSV vaccine can be given once every 2 years. So it's not something that you have to think about getting every season or every year, I should say. I like this chart from the CDC because it basically breaks down the vaccines to protect against severe RSV. And again, bringing up that category of adults 60 and over. And this is making that caveat of adults between 60 to 74 who are at increased risk and everyone over 75 years of age. And anytime is good to get vaccinated, but usually what you'll see is late summer, early fall, so kind of around this time of the year. Babies also a higher risk and pregnant mothers. It's difficult for anyone really to differentiate between like flu, RSV, COVID, the common cold. These are all viruses that cause very similar symptoms. And what you'll see is that they vary a little bit in terms of like what symptoms you see more commonly than others. Just like focus on this key here. Rarely would be the green X, sometimes would be the yellow or the orange X, and often is the red. So if we look at the RSV column, we see that more often we see wheezing. So that's just like more difficulty breathing, where you notice you're able to hear the wheezing yourself, or sometimes it really is like when you go and get an exam, when the provider listens to your lungs, you can just hear kind of this noise that shouldn't be there because you should expect for air to come in and out of your lungs clearly. But RSV is more known to cause this wheezing, more so this irritation of your respiratory tract. But you'll see here fever. Fever is something that's common between all of these viruses. And maybe you'll see it more so with the flu and sometimes with RSV. So this is just a chart to basically show that it is hard to distinguish one virus from the other because they cause a lot of the different symptoms. And it's the only way to truly know what virus you have is by using that nasal swab, and that'll test specifically for that virus. But you don't always need a nasal swab. It really depends on like how severe your symptoms are, because if you have a virus, we do expect that those symptoms should improve by like a week. Sometimes people take a little bit longer, it's like up to 10 days. What is helpful is just to know if someone's at a higher risk of developing certain viruses, kind of what you could expect. And if you're like at that point where you're out of that 7 to 10 day window, or you're having fever for more than like 3 days, that's worrisome that there could be something more serious going on. So COVID-19, I feel like none of us are any stranger to this virus. So it's caused by the SARS-CoV-2 virus. Typical symptoms are fever, non-productive cough, nasal congestion, muscle aches. Again, we would offer evaluation, offer a medical exam, a nasal swab, and treatment would be hydration, medication for any muscle aches, fevers, and possibly Paxlovid, which is this antiviral medication. And depending on who would be a candidate for these medications really depends on the person and like that conversation with your provider. So it's not everyone that needs the Paxlovid for COVID. Going into the COVID-19 vaccines, so we have the Pfizer and Moderna vaccines, and they're available for anyone 6 months and older. And you can get the booster if it's been more than 2 to 4 months since your last COVID vaccine. The children are a special category because if you've never been vaccinated, you get the 3 doses of the Pfizer, 2 doses of Moderna. But children, again, anyone over 6 months or older can get these vaccines. And the Novavax is a newer vaccine that's available for those 12 years and older. And again, you can get a booster if you've previously been vaccinated. And if you've never been vaccinated for COVID, you would need 2 shots, and it would have to be 3 weeks apart. Next, we'll go into the flu. So influenza. So this was respiratory illness caused by influenza A or B viruses. Again, similar symptoms as what we discussed with RSV and COVID, as far as like fever, cough, muscle aches, evaluation, also medical exam, nasal swab, treatment, hydration, medication for pain, fever, possibly Tamiflu, just to help with a virus. There's no antibiotics, there's like only antiviral. So this helps just like lessen the symptoms or kind of make them a little bit more manageable since it does last a few days. Just an overview. Prevention vaccines are kind of the one big thing that help prevent against these viruses, prevent against the consequences that could arise from having any sort of viral infection. So just wanted to summarize that here. We talked about the RSV vaccine. It's really adults greater than 60. We talked about like the 60 to 74 for those who are high risk, anyone who's greater than 75. And COVID would be 2 doses of Moderna, 3 doses of Pfizer. If you've already been vaccinated, kind of like the baseline, you have the boosters available. The flu, we have your annual vaccine, because a lot of these viruses, especially the flu, viruses mutate and change. And that's why there's a new flu vaccine every year. Sometimes I'll see in clinic and someone's telling me like, oh, I got the vaccine last year. Unfortunately, we have to have a new vaccine because the virus always changes and we have to keep up and help prevent against the variant that's currently active. Again, a lot of what we always worry about, anyone that has developed a viral infection can possibly develop a bacterial infection on top of that, because once you develop one infection, you're at higher risk of developing another. And with the viruses, pneumonia, bacterial pneumonia is a big consequence or a big thing that can come up. So those vaccines are available for anyone greater than 65. It's a one vaccine, and any adults that are higher risk of developing pneumonia, you can get a vaccine between ages 19 and 60. So I like this graphic from the CDC, just kind of breaking down fall and winter vaccine guide, because it's that time of the year, right? We're already in fall, and this is when we really get to see these viruses come up and affect individuals of all ages. So vaccines are helpful to help prevent those most vulnerable populations, those like children and older adults, especially in adults that are higher risk of developing any sort of infection. So I like this breakdown as far as COVID and flu vaccines, everyone 6 months and older, RSV to protect babies, as far as like pregnancy pregnant people and then also babies, and RSV for older adults. This also notes out that adults only need to get the RSV once, not annually. Something just to keep in mind. Where to get vaccines. So a lot of pharmacies have walk-ins to just get in and get your vaccines. There's also the New York City Health and Hospitals, testing and treatment centers. Their information is there because depending on like where you are in the city, sites where they give vaccines do change. So helpful to just keep track of that. And then virtual express care, and just another option for more of like a quick urgent care kind of thing where you can go and get your vaccines. Just a little plug here. So I'm currently rotating or work at Settlement Health Clinic, which is on 106th Street between 2nd and 3rd. I'm a medicine and pediatrics provider, so I see both adults and kids. And if anyone's interested in or needs a PCP, please call the office and try to get scheduled. We do offer the vaccines.